Welcome back to Self-Care with Tika. And today I am so excited about this current episode. And we're going to talk about a topic that is very near and dear to my heart. A lot of you have sent me a lot of great ideas, great topics to talk about. Thank you for being engaged. I appreciate your feedback. But today, we're going to dive into something that is so important, not just to me, but to my community. So we're going to talk about the topic later. But what I'm more excited about today is I finally have a surprise for you all. Do you know what it is? I have my first guest. Exactly. So if you remember at the beginning of Self-Care with Tika, I did mention how I'm surrounded by a lot of great professionals, great individuals. People are doing their thing in their own space. They are doing the things out there in the community. What I love about a lot of the people that I consider to be great people, they're not just great people, they're not just professionals, but they're also great friends of mine. So today I have the pleasure of introducing somebody that I love very much, somebody that's a friend. One of the reasons I have this podcast is because of her accountability, her speaking to me, her supporting me. So I'm so excited to not just have her here, but for her to bring her expertise, Self-Care with Tika. I'm very excited to welcome my first guest. This person is a philanthropist. She's a mom. What I love about her, she's so humble. So when I asked her to come on this podcast, it was no-brainer. I love working with her. I love doing business with her. She's the co-founder of Reveye Mental Health, which we'll talk about later on. So without any further ado, I want to welcome you all, Reynette Romain. Ray, I had to say your government name.
I am good.
Welcome to Self-Care with Tika.
Thanks for having me.
Listen, as I said, people don't understand the network, the wealth of people that I'm surrounded with. Like, I am so excited to have you here, to welcome you here, to be my very first guest. You know you're my first guest.
I'm excited. That goes down in the history books.
The first guest of Self-Care with Tika. So we're going to remember this when we go all the way to the top.
Yes.
Because that's where we're going,
We
right?
are. Absolutely.
Okay. So I know I did a brief introduction about you. So do you want to tell my viewers or the people who are watching you or who you are and what do you do or anything else you want people to know about you?
All right, of course. So my name is Reynette Romain. I am a co-founder of Reveye Mental Health and Wellness. It is an agency that provides mental health services primarily to the BIPOC community, but we do service all. And our focus is on making sure that our Caribbean folk and folk who look like us know that they have access to mental health support. So it is a counseling agency. We provide services to people of different genre with different concerns stemming from anxiety, bipolar disorder. I personally specialize in couples counseling. So I'm originally from Orlando. I do have 2 baby boys. I'm a mother of 2 boys. They're not babies, but they're my babies. And I'm originally, again, from Florida, still based out of Florida. And I am excited to be on your show. I'm excited to be here. I'm excited for, to share whatever it is that I can help with.
Okay. Well, you know why I have you here, right? It's one of my favorite subjects. I have people that's been emailing me and say, when are you going to talk about this? When are you going to talk about this? So our topic today is mainly about therapy.
Okay.
What is therapy, Ray?
Ooh.
What is therapy? Mental
this.
Health counseling, because there's a lot of different therapies. So What is mental health counseling when it comes to therapy?
Okay. So mental health counseling, aka therapy, it is where you literally come and you talk, right? But in your talking, you are processing a lot of what you've experienced. And as you're sharing, I am a mental health therapist on the other side, based on the education that I've received, the knowledge that I have, I do consider myself to be an expert in this field.
Right.
So I'm able to pick through what you're sharing to help you identify exactly what's going on and perhaps why it led to, let's say you struggle with anxiety.
Yeah.
How did your life experiences bring you up to this point of having poor mood management or behavior management? How is it that, you know, an experience where you witnessed your parents fighting or debating, how did that lead to now fear of being around people or fear of being in relationships or having anxiety? So that is what therapy is. It's talk.
I love that. And, you know, and I love how you brought up, like, you know, anxiety or depression or maybe some form of trauma. And I know sometimes we do have like a stigma that sometimes apply when it comes to therapy, right? So what I'm trying to say is, do we have to have a form of mental health or mental illness for us to go to therapy? What if I don't have anything going on, but I still want to go to therapy?
Let me tell you, a lot of times people, and that's a really good question, by the way. A lot of times people will say to you, there's nothing wrong with me, so why do I need to go to therapy? Right? But what I've noticed also, people will come and say, I'm coming to therapy because that's the thing. It's a trend, right? Everybody's like, I have a therapist, so I want my own therapist. Okay. So they come in thinking everything's all fine and dandy, but as they share and they process and they start, you know, describing these experiences that they've had, they learn that there is something deeply rooted that's happening. To them, it's nothing wrong because they're accustomed to it. It's second nature to them. But to me, it's like, wait a minute, you've been through a lot. So the short answer to that is no. You do not need to have an actual diagnosis to seek counseling. I often say come to counseling so that you can find out what's wrong.
Yeah. I love that. Come to counseling so you can find out what's wrong.
Absolutely.
Because a lot of the time we're like, oh, I'm good. I'm in a very, very great space in my life. Or next one is, I don't need to talk to a stranger about my problems. Or why would I talk to a stranger about my problems? And, you know, I'm not a therapist today. I'm just, you know, interviewing. But what is it about people that doesn't want to go to therapy because they feel like they're talking to a stranger about their problems?
Well, that happens a lot.
Right.
And it's expected, especially in our community. When I say community, Black and brown folk, Caribbean, especially Caribbean folk, the idea has always been to keep private matters in the home. What happens in the home stays in the home, right? So a lot of times people avoid going out to speak to strangers because the fear is, if I talk to you about my problems, somehow, some way it's going to end up at Tom's house, Ann's house, Claudette's house, so on and so forth. But I would like to say this, if it's okay.
Yes.
Counseling, especially when you're seeing a professional counselor who has the educational background, who's also binded by HIPAA laws, right? We have a code of ethics that we have to follow, and a big part of it is we are responsible for maintaining privacy. We call it HIPAA laws. So we cannot talk about what you come to therapy about. Absolutely not. We can't share it with anybody. And the biggest trick, I'll tell you this, if you have a therapist that you run into in public, you can act like you don't even know your therapist, and things will be just that. Trust me, just act like you don't even see them. And see how they function. They'll act like they don't know you either.
You know, it's so funny. I'm laughing because I used to see my clients all the time, especially when I go grocery shopping. So sometimes I would literally find a different place to go shopping. And, you know, at the beginning of the session, how we're like giving them, you know, the truth, like what you need to do. And I remember I was talking to one client and I was telling the person, like, you know, if you see me in public, you don't have to acknowledge me. And the person was like, oh, I could never do that. And I was like, oh, great. But don't introduce me as your therapist, okay? Please. And then that's just us protecting you, right? It's no shame you going to therapy, but also we want you to have that space that, you know, like my place of worship is my place of worship. Like, people know if I know you, I can't see you. That's the law. And I feel like even if it wasn't a law, that still would be my law. Like, I don't want to know anything about you. That is my place where I am, where I can be, and I know when to take the hat off, and I know when to be Korean.
Absolutely.
Right? So with that being said, you being a therapist, do you find that a lot where you may be giving an advice, or people are like sometimes embarrassed to talk in front of you because like, oh, there's a therapist here? Do you find that, and how do you deal with that, if you ever? Listen, it's hard out here sometimes.
It is very hard.
Yeah,
that happens a lot. The minute you can have casual conversation, the minute they find out that you're a therapist, it shifts. And what you hear a lot of times is people say, well, are you therapizing me? Or are you psychoanalyzing me? Or, or if we provide genuine feedback of something that is close to our heart or that we have knowledge of, automatically it's,
from the book.
You're giving therapy now. And
So how do you deal with that?
To be honest, I'll be like, well, then don't talk to me.
Sometimes like, that was me talking. Okay, I'm actually naturally smart. One of the reasons I'm in this field is because I'm good at giving advice.
Exactly.
So it's nothing about, the book that sometimes we don't always, it's not always pulling back from the book. It's our experiences.
Yes.
Because before we were this kind of professional, we actually were good at giving advice.
Yes.
So when you're around a therapist, we are just talking from the heart at times. So just to let you know. But, one thing about me and of course you is, I know you're a woman of faith as well. So I wanted to ask you, what are you seeing now in the churches when it comes to mental health? Because we know our people are not always welcome to go to therapy, right? So what's going on with therapy in the church? What are we doing to educate our pastors, our leaders? What's going on?
That's a really good question. It's a touchy question, touchy subject. I honestly think more and more people are open to it. Okay. Especially within our younger generation. The generations that came before us, they're still having a bit of a hard time because remember, it's hard to undo what you've already learned, right? So if you are accustomed to the notion that what happens in the home stays in the home, I don't need to speak to a stranger about my business, then you're stuck on that. And in the church, you have to think about it. There's a mixed genre of age groups, right? So you have the younger folk who are open to it and they're like, I need a therapist, I need to see my therapist. The older folk still mindset is stuck in what it was. But what are we doing with our leaders? So one of the major things that I like to push is that pastors understand the power that you have under God, of course. But the power that you have is the people in your congregation, they listen to you. They listen to your guidance. They listen to your feedback. They take a lot of that into consideration, just as they do a doctor. Especially in our culture. Our cultures trust pastors and they trust doctors. Okay? So if you are in that position, my encouragement is that if you know the value of counseling and you know that it's too much for you, because pastors, you guys have open door policies. You are the pastor, you're the counselor, you're the teacher, you're the parent to your congregation. So I would encourage that you guide your congregation to seeking counselors. Find out who are the counselors in your congregation. Get their business cards and business information. Hand it out to your leader, your followers. Hand it out to them. Let them know that they should go and seek counseling, especially such as myself. I'm faith-based, so I can always reference the Bible in our counseling sessions.
Do you pray before therapy?
Girl.
Yes,
I do.
Give me a little bit. Okay. Do you pray with your clients?
When my clients request prayer, I absolutely do. We do a lot of Bible fact checks, right? Bible references, and I pray because we are in a very delicate environment, the population that we treat are very delicate, right? And if you're thinking about it from a spiritual standpoint, we will know that depression and anxiety, those things are spiritually rooted. So the prayer for me is covering for myself, right? Blood of Jesus cover me, but also the prayer is, God, guide my tongue so that whatever I share with this individual, whatever I teach, however I guide them, that it is from you.
Yeah. And I love how you said that, because one of my favorite group of people that I used to love to see was the Christian base, because there's so many things you can link from the Bible to every day. Like we always say, there's nothing new under the sun, right? So sometimes you're reading the Bible like, wait, this is in there, right? So, or even sometimes somebody's going through such a difficult situation, I would literally be like, there's nothing the book can tell me to do right now, Lord, give me something to tell this person, right? And I love how we can rely on other people, or like, our therapists, that we know that finding myself praying for my clients, even when I'm praying for myself or what's going on. So I think that's one of the good benefits too of having a Christian or somebody that's faith-based that goes with your faith. So just to see how you can correlate your biblical values with what's going on with you. So and I'm glad you answered that too. And I know you in the churches a lot. We go a lot into the churches and preaching, not preaching, not preaching, but educating our people about what is therapy, what does that look like. I love when our pastors reach out to us and say, hey, I'm not preaching this Sunday, can you come do a brief presentation? That's the partnership that we do need, because at the end of the day, I feel like one of the reasons people may not go to therapy is the lack of education. And I feel like there's a big part of like that we need to continue to push forward. Like, if you're not going, why we're not going, right? The next one usually is what? Money issues. So how do you guys deal with, I want to go to therapy, but I don't have the money?
I love your questions, girl.
It's coming from above.
You ease them right in, honey. I love it. No, that is a really good question. So there's insurance. That's one. Everybody doesn't have insurance, but insurance is your primary go-to. Don't be afraid. If you're working and insurance is provided through your employer, you're still paying for that. So you do want to maximize the benefits of insurance, right? And all you have to do is reach out to your insurance carrier. The name of my agency is Reveye Mental Health and Wellness. So a simple tutorial would be, reach out to the insurance company, tell them, hey, I'm interested in mental health counseling services. You can be specific. I want in person or I want virtual. Let them know this is the company that I've been looking at. Are they in network with us? In network simply means that we are contracted with the insurance company, so we provide services at a rate that's affordable to you. And typically what will happen is if you have a copay or deductible, you'll cover that. The other option, if you don't have insurance, let's say you do work, but you don't have insurance, you can always reach out to your human resources. Ask them about EAP. EAP stands for Employee Assistance Program. A lot of times your employer offers EAP and you may not know about it, but EAP gives you free counseling services. And again, you can reach out to us, find out if we're contracted with your EAP network. We do accept out of pocket, so we do accept cash, but we're talking about individuals who don't have it, and that's okay. Reach out to us anyways, and we are going to help you find the resources. We also work with Loveland Foundation. I love the Loveland Foundation. They offer vouchers to women who look like us. And you get counseling services. You get like up to 12 sessions.
Oh, wow.
And that 12. Is a lot.
That is a lot.
I love
that's
like
3 months, right? Okay.
Yeah.
So I like that. I love the resources, because a big part of this is not just the signs, what do you do, but where do I go? What do I do, right? And I feel like that's another reason, the lack of resources. So I want to ask you as well, for somebody that may be struggling with mental health, or what does that sometimes look like if somebody's going through a midlife? What does mental health look like?
Oh, man. Whew. Mental health, let me tell you, it can look like a lot of things. But internally, you know that something's going on if you are not yourself. That's one of them. If you can't catch a break, that's another one. So let's say in your mind you feel like I am myself. I've always been this way. But the way that you've always been is restless, always worried, always thinking, can never relax in a positive moment. It's always like, oh my goodness, what's going to happen next? And when is the ball going to drop? If you're having restless or sleepless nights, right? If you have difficulty completing tasks, all of these things fall under that category. If you're hearing voices, seeing things, having thoughts to hurt yourself or someone else, there's so many different reasons, right, that to seek mental health counseling and to know that something's off.
Right.
But just pay attention to who you are and pay attention to how you are.
Yeah.
We do have ups and downs. We do cycle in and out. But if you are cycling and it's down and it stays down for more than 2-3 days, you know something's off. If you cycle up, we call it mania, and you're up for more than 2-3 days, and it's a up that's hard to explain, probably need to go seek some support. If you can't sleep, seek support.
Okay.
So yeah,
I like that. You know, it kind of made me think of, I love how you say life go up and down, right? Because sometimes you hear people say, I've been in therapy for 10 years, right? But it doesn't mean that the whole 10 years. It could be like in and out of therapy, because they do that check-in to make sure, like, when they're very self-aware, okay, I've had a life transition that recently happened, whether it's a divorce or a new mom or a college student, whatever your title might be. It's always good to do that check-in with yourself, with your therapist, to make sure, like, okay, let me just do a little check-in and everything. What happened if I don't like my therapist?
That's a good question.
Right? What if I'm not connecting? You know, we're talking about all the great things, but what if I am doing all the things and I'm not connecting? What do I do?
That's a real question, a good one too. Well, what I always encourage is, one, don't compare therapists. That's one, because that can cause a block in whether or not there's a connection there. The other thing is, I always say, give it a good 3 tries.
Yeah.
Right? When you go in, give it your all. All you need to be doing in counseling is sharing. So if you're asked a question, talk about what's going on. If there's a connection, you'll know. And another thing that supports connections is being clear about what you're seeking in your therapist.
Ooh, say that again.
Being very clear and transparent about what you're seeking in a therapist and in counseling. So what does that mean? If I'm coming in and I know that I struggle with self-motivation, or I struggle with getting things done, I might say, okay, I come to counseling, I'm going to share everything with you. I need you to help guide me on what to do next. Or you might say, when I come to counseling, all I want to do is talk. I need a space to vent. This is my outlet. Okay. Be very clear about what your goal is in counseling so that you can make sure that the connection is good. So to answer your question, if you don't like your therapist after 3 good tries, 3 good tries,
clear,
and you have made it very clear about what your needs are in counseling, and it doesn't work, then go get another therapist. It's your journey, it's your healing, it's your treatment. Go and get another therapist, and don't give up until you find a good match.
I love that. Go, right? Because not just, and do you get sad when you get fired? Not fired, but when it's, because we do find people where we're not a good match for, right? For me, I connect a lot with the Caribbean, Haitian, and not that I don't connect with other culture, but I know when they come to me like, oh, you speak Creole, I don't have to, like, you know, I don't have to tell you about the Haitian culture, like, you know, so versus someone else, then sometimes they may not find the connection. And it is about your healing, right?
I've been fired.
We've all been fired.
I have been fired, but my thing is, and I've had guidance from like mentor therapists or people who are more experienced than myself, because I do seek that supervisory guidance and everything. And you know, whenever that happens, I do feel emotionally challenged. Like, oh my goodness, am I a bad therapist? What happened? But I've learned to accept that it's not a personal matter. it's not my journey.
Yeah.
If it's not a good match, and I'll tell you straight up, it's not working out, that's fine. But I do request feedback.
Yeah.
Like, in what areas do you think I can work on, or in what areas was there like a shortcoming that I could work on to help with future needs if needed. So I don't take offense.
We don't. And I think that's where being like, when you specialize in something comes in, like, you know, like I specialize in depression, I specialize in anxiety, I specialize in self-care, right? When it comes to certain other areas, it's not like we can't do it or I can't do it. It's more so, this is what my focus is. And I know when these people come in, I know exactly what I need to do. I can close my eyes and tell you all about self-care, depression, CBT, DBT, whatever it is. Modalities that we have, that's what we do. But speaking of modalities, what is your favorite modality? Like, what are some things that people like, things they expect? Like, you know, sometimes they think they're going to lay on the couch to talk to you. What does therapy look like for you? Or, you know, for us on the field?
Look, in office setting, there might be a couch that you can lie down on. Therapy, what does it look like? It can look like this. Right. So, comfort of your own home. That's a big one. You don't have to drive anywhere, and thank God insurance provides that as an option. You can have in-office service. There might be a couch there that you can sit on. But counseling is literally talking. It's you. Whatever you bring to the table is what's worked on. If you bring nothing to the table, there's nothing to work on. So, that's what therapy looks like. Whatever you want it to look like.
Okay. Well, what do you do for fun? This is a self-care podcast. What do you do for self-care?
Oh, my goodness. Let me tell you something. Big bag.
Big bag.
I love to eat.
Okay.
And I promise that's my self-care. I love to eat. And my style is to go out. Say you and I go out, I like appetizers. Like, just order, fill up the table, and I want to sample everything. So that is primarily my self-care, but I love to hang out with my family. I love my family, and I love my babies. So that's my self-care.
Now, let me ask you one more question. Do you have a favorite population of people that you work with or you enjoy working with?
I do. I love to work with men.
Okay. If you're a man, get with my girl.
I love to work with men. I really do, because I have this theory that men are told to be men and to man up, but they're not guided. There's no guidance on what that means and how to be. So definitely, I love to work with the male population, and I also love to work with couples. That's my specialty.
I love that for you.
So,
you know what's coming up, right? It's my favorite segment. A lot of people's favorite segment is the sip of self-care. Literally. So, let's get our cup. Cheers.
Cheers.
Stay tuned. We're coming. So I wanted to kind of practice, like, for a lot of myself included, when we are stressed, what is something we can do briefly just to kind of bring us back to the present?
Oh, I love it. So yes, there is a strategy in counseling. It's called grounding, right? It's big in the DBT world. But grounding is simply, you are tuning into what's in your environment and what's going on internally in order to bring yourself back to the present. So can I walk you through?
Of course.
Okay.
Use me.
All right.
Use me, Reynette. Use me.
Right. So go ahead and close your eyes. And I want you to take a deep breath in through your nose and out through your mouth. On the second round, I want you to slow it down. So you're going to take a deep breath in. 1, 2, and release out through your mouth. 3, 2. All right. You're going to take a deep breath in. And as you breathe in, I want you to focus on what you smell. Release. Breathe in again. And I want you to focus on what you hear this time. So soothing. Release. You're going to breathe in again. And I want you to focus on what you feel. So just rub your hand on your thigh or rub your hands together. Focus on what you feel. Release. You're going to breathe in slowly and focus on what you taste. Release. And you're going to breathe in with eyes closed. I want you to focus on what you see. Okay? All right, release. Go ahead and open your eyes and come back. So that was just a speed through one of the many grounding strategies that I love. What were you focused on during this time?
I think it was my breath.
Okay.
You know, and I know, speaking of Christianity, like the first thing God gave us was what? The power to breathe, right? So for me, a lot of the time, you know, we like breathing until you can't breathe. That's when you really realize, oh, I need this to function.
Yep.
So I love how that clarity, it kind of like provided me to like breathe in and breathing out. And that 5, was it like, that was less than 5, right? Literally to the 5 senses. So that was easy. So that is something we can always practice, right? Deep breathing exercise, being mindful of where we are. You know, we can do that before a meeting, before if you're in the middle of an argument, because you do see couples, so sometimes we don't always get along. So just take a breath. Take a breath.
And as you focus on the senses, if I'm focused on what I'm seeing, hearing, tasting, touching, or smelling, I cannot think about anything else in that moment. Okay. So if it gives you even 5 seconds of clarity,
then
do it.
Right.
Ground yourself.
I love that. So before I let you go, I need to let our viewers know this episode was sponsored by Reveye Mental Health. And I'm going to let Reynette do all the talking about where you can find her handles, her practice, and so much more. So take it away, Ray.
So, again, my name is Reynette Romain. I am a co-founder and CEO of Reveye Mental Health and Wellness. Reveye means to awaken in the Creole language. So we are physically located in Florida. We offer in-person services in Palm Beach as well as Duval, Jacksonville, Florida. And we provide virtual counseling out of the state of Delaware, Utah, and Massachusetts. You can find us at Reveye, spelled R-E-V as in Victor, EYEMH.com, or you can give us a call at 561-257-1877. Feel free to look us up. Feel free to give us a call. We are available, or we'll make ourselves available. We do provide in-person and virtual counseling. We take most major insurances. We also take EAP, and we also take Loveland Foundation vouchers. So just give us a call. We are here. And if you call us and we're not a good match, what we will do is make sure we connect you with someone who is.
One last thing. Nous parlons créole.
Nous parlons créole.
So, si vous parlez créole, si vous reach out pour Reynette, pour qu'elle toujours parler. So, pour tout Haïtien, all the mummies, tout mamie, mata, tout tonton, réfère parce que yo parle créole. Okay? So, right, thank you for coming to the podcast.
Thank you for having me.
I promise you this is not the last time, okay? Because this lady is a wealth of information. I'm sure there's a lot of different topics we can talk about that we plan to talk about. So I cannot wait to bring you back, bring your staff back. So the other girls, just know I'm going to be looking for y'all to come back here, okay? So thank you for coming, Self-Care.
Thanks for having me. I love you.
I love you more. So cheers to many more memories.